Sorry, some pop-up. So we always think that we are good, but when we can analyze our work, we can evaluate our work, then only we'll come to know that how good we are. So in dental photography, you can click the photograph, you can zoom it, analyze your work. That have you done the treatment properly? Is the cementation, crown cementation was done properly? Is there any marginal discrepancy or some other error that was not we are not able to see in our naked eyes? Then communication with the patients as well as for the dental technician, especially in a patient who have bad previous dental experience, photography play a very important role. So for example, if patient comes to you and patient have horrible previous experience that patient is not satisfied with the treatment, what you can do, you can click the photographs and you can explain the patient then what type of treatment you're going to deliver it to them. So you can gain patient confidence and then you can deliver the treatment to the patient, because patients are very apprehensive that what's going on into the patient mouth. So you can show it to them that what you're going to do. Second, for most important, for lab communication. In aesthetic dentistry, shade mismatching is the biggest issue. So in a dental photography protocol, at least 3 photographs are recommended, minimal, for lab communication. You send the photograph that is sufficient for a lab guy to understand what type of crown or processes you want, as compared to you given to them as a written format. You can take 3 photographs, such as first normal photograph with shade guide. Remember, when you're taking photograph with the shade guide, the shade, that number A1, A2, A3 should be visible. It should not be cropped. Second, polarized photograph. What is polarized photograph? We are going to discuss in next slide. And third, to analyze a photograph where micro and macro anatomy is visible, because we cannot capture the micro and macro anatomy with a normal photograph. You have to capture at 12 o'clock or in different angulation with different light position that I'm going to discuss in upcoming slides. So these 3 photographs, and according to some other authors, black and white photographs also is recommended for lab communication. I mentioned here about polarized photograph. So what is polarized photograph? Polarized photographs, polarized filter is in a mobile polarized filter is like that. If you are able to see, polarized filter remove the glare from the photograph or remove the flashlight effect from the photograph. So it is very helpful when you're doing shade matching, especially in the in composite button technique. What you can do, you can place different shade of composite over that teeth and take a picture with the polarized filter for. So the shade that disappear first is the shade of the teeth for dentin as well as for enamel. So this will be very helpful for shade matching photographing. As well as with polarized photograph, you can analyze the if any enamel defects are present, or if any crack line is seen, or white spot lesion. These all can be seen in a polarized photography. The next important element in dental photography is evaluation of treatment. Every step can be recorded. When I was studying in my post-graduation time, that's what we taught, that every step you should record, from pre-operative photograph, then the treatment, what we are doing, that photograph, and post-operative, and as well as follow photographs. When you have this type of set photography, that will be very helpful for you for documentation as well as for medical legal purpose also. It is very important. Next, you can document it and then you can present it either in seminar, in conferences, or you can, like this lecture, you can present your work. And also the standard journal have very strict criteria for publications. So you have to click good photograph for either for your thesis or you're doing any case report. So the standard photograph, when you click, so the chances of acceptance rates are very high. If poorly photographed, you upload it in a standard journal, the chances of rejection is high as compared to acceptance. Then for your clinic, marketing is very important. You can see that this is the number of daily users. For Instagram is like 1.36 billion, for FB it's 1.3 billion, and for YouTube is 2.291 billion users. As well as you can put your work on WhatsApp status also. So for clinic advertisement and marketing purpose, photography play a very vital role because this is a digital era. The next come to artistic photography that you can put on your clinic, or you can publish on your social media profile for your marketing purpose as well. Then insurance and medical legal purpose also. Most of the insurance company don't understand dental terminologies. So if you provide evidence for them as a photograph, that will be very helpful for patient. Or if patients sue you that you have not done the treatment properly, so you have the evidence as a photography format, you can show it to the in medical legal cases that can help you. Now, question arises that how does any camera work? Either it's a DSLR or a smartphone. The concept is very similar. You can see in the picture, the light enter through the convex lens and it hit the image sensitive medium and the image is captured there. This is a simple concept. Either it's DSLR, mirrorless or smartphone. So question arises, what all equipment needed for our dental photography? The first and foremost important element is camera, obviously. If you want to invest in smartphone, then lens is not needed. You don't need any additional lens. Smartphone have sufficient. Then most important thing you have to invest is lighting. You have to invest in good amount of light. I assure you, if you have good smartphone, so the maximum you need 10,000 rupees, you can get good lighting products. That will be helpful for you for photography, because photography is all about lighting. If you have good lighting, you can click good photography. Poor light, poor photography, because photography is all about, again I'm saying, light. Then and you need next mirrors, contraster and retractors. Now this is the first photograph taken, first ever photograph taken from a smartphone of Sophie Khan in 1997, and this is the 2022 photograph taken from an iPhone. Can you see that how drastically the smartphones cameras are developed in very few years? So now smartphones cameras are, I will say normal terminology, damn good. You can click good photograph with your smartphones. So first thing, which type of camera we should buy? If either smartphone or DSLR, which type of camera you should buy? Many people think that we should invest in iPhone, high upper flagship phones or Samsung flagship phones. It's not true. If you want to invest in a camera for photography, especially dental photography also, what you have to look, the size, weight, the shooting modes available, and the sensor size. Camera should not be too bulky. In a smartphone, don't invest in tab for dental photography, or don't invest in very big size of camera, because you will get fatigued. You cannot able to take good photograph. You cannot able to hold for long time. So it should be compatible, and the sensor size should be big for either a smartphone or in DSLR cameras. So the next problem arises when you invest in camera, that's called gear acquisition syndrome, or many of us face this problem. If you start learning photography or you are into photography, you might face this problem. What is this syndrome, gear acquisition syndrome? Suppose you have a camera, like I had Oppo F3 earlier. So I have Oppo F3 smartphone. I click a photograph of any object. The photo doesn't appear good. So I thought that my smartphone is not good. I have to invest in flagship phone. I invested 1 lakh rupees in a Samsung smartphone and I purchased that. Again, I click the photograph of same object. What happened? The photograph is similar, same like Oppo F3. So I wasted a big amount of money. This is a gear acquisition syndrome. If you're a DSLR user, suppose you have basic DSLR, you click a photograph, you think, no, my DSLR is not good. I have to invest in bigger lens, bigger smartphone, bigger DSLR camera. It's not true. What smartphone you have or what DSLR you have, you can click photograph with that only. So the best camera is the one you have with you now. So what all feature you should want for dental photography camera? The first, sensor size. So if you are using Android or iPhone, current smartphones from last 5 years what have launched, so the quality of sensor is quite good. And megapixel, now companies launching few smartphone like 200 megapixel camera or 180 or 108 megapixel camera. It's totally irrelevant. If you have 12 megapixel camera, that is sufficient for a good photograph. Even if you have 10 megapixel camera, you can take good photograph if you have good lighting. So important thing is lighting, not megapixel. 10 to 12 megapixel is sufficient for smartphone for dental photography. And definitely, as compared to Android, iPhone have bigger sensor or good sensor. So sensor play a significant role in photography compared to megapixel. So what are the advantages of mobile dental photography as compared to DSLR? First, it's very cost effective. The budget for smart DSLR is very high as compared to smartphone. Now, I suggest here, if you are planning to invest a smartphone for dental photography also, if you're planning to purchase, divide into 60, 30, 10. Means if your budget is 50,000, so 60% of 50,000 should be invested into a smartphone, but 30% in lighting and 10% for other accessories like mirror, contraster, and other accessories for dental photography. Don't invest entire amount into mobile only. Second is weight. Smartphone is definitely too lightweight. Learning curve for DSLR, this learning curve is very different. Like if you're into Nikon, you cannot shift easily in Canon or Sony. It's difficult, but if you're an Android user, you can take any phone, you click a photograph. Even if you're a smart and iPhone user, from any iPhone, you can click good photographs. It's not that difficult. Also, for DSLR, what you are using light is momentary flash. The problem with momentary flash is you cannot see the object, how it will going to appear after flashlight. So you have to adjust flash manually. For smartphone, we are going to use continuous light. So what you are seeing now with your naked eye, that exactly photograph can be captured with your smartphone. And definitely disinfection of a smartphone is very easy. Just wrap it and click photograph. Now, I want all of you, please take your phone, and if you're an Android user, so go in a pro mode, and if you're an iPhone user, go in a pro and expert mode. For iPhone, when you open an iPhone, so in photo section, you just slide up, so the pro mode will appear. What is the interface? I will show you. For Android, the interface look like this. Please open your smartphone. So the first thing is setting, aspect ratio, timer, histogram, flashlight, white balance, focus, zoom, exposure value, shutter speed, and ISO. I'm going to explain all this in detail now. And if you're an iPhone user, this is the format, how it's going to appear. So please, all of you, open the pro mode. In either you're Android or iPhone user, doesn't matter. So now let's understand basic thing about photography or basic element. First is shutter speed. What is shutter speed? In a simple word, shutter speed means you can control the motion. If you control the shutter speed, that means controlling the motion. For example, faster shutter speed, you capture the motion, and the slow shutter speed is used for nightlife and astrophotography. If the shutter speed is faster, the moving object will appear still. Like the first photograph, you can see here the aerosol production aerotor photograph. This is the faster shutter speed photograph. And the second photograph here, light moving, that's slow shutter speed photograph. In dental photography, the object is not moving, it is still. So the recommended shutter speed is 1/250 to 1/500. Now next is aperture. Aperture is the opening of the lens. Okay, so the bigger the opening, more amount light will enter, and lesser the opening, less amount of light will enter. So what shutter speed will do? Shutter speed control the motion. What aperture do? Aperture control the depth of field. Please understand this. Shutter speed control the motion and aperture control the depth of field. If there's a larger aperture, the depth of field is narrow, means less area is in focus. If aperture is small, the depth of field is large. That means more area is in focus. Understand? Again, I'm saying if the opening is more, the less area is in focus. If opening is less, the more area is in focus. This is a simple concept. But the smartphone have fixed aperture. When very few flashy smartphone is giving option of variable aperture, or else smartphone have fixed aperture. But again, even though the smartphone have fixed aperture, that is f1.7 with bigger opening, the depth of field is not shallow, it's very deep, because smartphone cover the wide angle photography. So the area what you're trying to focus will be in the what I'll say in deep, you will get proper depth of field. Okay, smartphone always use wide angle photography. So for dental photography is very easy to click photograph. Now please understand this. In depth of field, always follow rule of 1/3 and 2/3. This is very important rule for dental photography. What happened? Our dental arch, either upper or lower arch, is an arch shape. It's not a straight line. So when you want to click a photograph, what we always do, either as DSLR or a smartphone user, always they focus on central incisor. So there's a concept. From the focal point, 1/3 anterior and 2/3 posterior will be the focus. So for example, if you focus on central incisor, so 1/3 anterior is gone. So from 2/3 posterior means till premolar or till canine, you will get focus. So that's why whenever you click photograph and you click on central incisor, you will get till canine proper image. From canine to molar, it's completely blurry. So always click on canine. Doesn't matter which canine, you click, focus on canine and then click the photograph. Understand? Always focus on canine. Clear? Now next is white balance. White balance means the temperature. I hope you understand till now. Shutter speed means controlling the motion. Aperture means depth of field, and white balance means temperature. So for daylight, temperature is 5500 Kelvin. iPhone users don't have this feature. In iPhone Pro mode, you will not get the option of white balance. For that, you have to download a software. I will tell that which software. In Android, in the Pro mode, you will get the option of WB, that's white balance. The recommended white balance for dental photography is 5500 Kelvin. And the light what we are going to use, that also integrated to 5500 Kelvin. Next is ISO. This option is there. ISO means sensitivity to light. Okay. So if you have good amount of light, so the ISO recommended is 100. So dental photography, we are using good flashlights. So the ISO is 100. So the less amount of noise will be there. Now for easy way to understand this, please see this picture. The first image is low ISO. That means picture is very smooth and clear. The next image, second image is with higher ISO. Increase the ISO, the more amount of noise or grainy dot you can able to appreciate in photograph. Higher ISO is recommended for night life photography, so more amount of light can be adjusted. Clear? So I'll just summarize in short word. Shutter speed means controlling the motion. Aperture means controlling the depth of field. ISO means noise, and white balance means temperature of light. This four concept you have to understand this. Now, histogram. Histogram is a graphical representation of the photograph. If your histogram, this can be seen in Pro mode. If your histogram is towards right, that means your picture is overexposed. If it is toward left, that means it is underexposed. So it should be at center. Histograph is a graphical representation. If you are unable to see in your smartphone, just click the photograph and open the Adobe Lightroom. In that, histogram will be visible. Now, I have mentioned that you have to invest in light. So which of the light is important? For smartphone, there's a continuous light like Smile light. As you can see here, Smile light is a bit costly. It's 400 euros. Then what I'm using is Unique Movie Flash Pro. That's come around 10,000 rupees. Okay, the best part is this flashlight can be removed and free-handly we can use. Then ring light, I personally don't recommend to use this. Ring light is not that effective. And LED panel, this can be used for, LED panel can be used for portrait photography. Okay. Now, there's two types of light. First is bounce light and second is diffuse light. Diffuse light means so when you switch on the flashlight, so the light directly is going to fall on your face or teeth. That is diffuse light. Second is bounce light. Bounce light is a reflected light, either it's from your wall, ceiling wall, or from patient clothes. That's why it's recommended that patient should not wear dark clothes or like too red or too greenish clothes, and lipstick should be removed because this is going to affect the shade of the teeth. So what are the important rules for MDP? First, smartphone preparation. Smartphone lens should be clean and it should be properly wrapped. Smartphone should be wrapped. Only lens should be open so you can click photograph. Next, hold the camera properly. Don't, because if you're using tab, it's difficult to hold. So hold with your two finger, either it's left hand or right hand, and then focus and click. Next, white balance. As I mentioned, for Android user, just open the Pro mode and adjust the white balance. If you're an iPhone user, you have to download this app, Yamara Pro Camera or Selfie Pics. I recommend you use Pro Camera. That is very easy to use. And in that, you get the feature of all Pro mode, like ISO, white balance, everything. You can get this feature. You can able to access it. Again, one of the beautiful app is Light Spectrum Pro or Color Temperature, Color Temp Meter. With this app, you can see your area's room white balance temperature. Either is more than 5,500 or is less than. So you can adjust light accordingly. With this app, you can see the room temperature. Now, next important rule here, when you're clicking the photograph patients intraorally, remove the saliva, bubbles, and adhesive material what's flowing, or if any bleeding spot is there of lipstick, this all part should be removed. Prepare the patient, then click the photograph. Then background should be unanimous. It should not be like disturbed background. It should be unanimous, completely gray or black background is recommended. Now, the first question arises, what distance we should use if you're in a smartphone. For smartphone, the recommended distance is 15 to 20 centimeter for intraorally, and for extraorally, 150 to 180 centimeter you can use. So you can get good, same like DSLR photograph. If you went closer to that, for example, for intraorally, if you went more closer to 15 centimeter, you will get distortion barrel, means photograph will appear a bit roundish. And same for portrait. If you go closer than 150 centimeter, so the portrait image will get distorted. That's called distortion barrel. To avoid distortion barrel, you should maintain this distance at least 15 to 20 for intraoral, for extraoral 150 to 180. So the golden rule for MDP is zoom, focus, and shot. There are two. I'll just explain about zoom here. There are two types of zoom. One is optical zoom, and second is digital zoom. Optical zoom, if you're if you're a DSLR user, the lens zooming is called optical zoom. The best part of optical zoom is image quality will be same. It won't compromise. Digital zoom is cropping the image. So many smartphones are giving the option of optical zoom, like 1x optical zoom or 2x optical zoom or 5x optical zoom. So till recommended optical zoom, you can zoom it. Image quality will not get affected. More than that, if you zoom it, the image quality will hamper. So till optical zoom, you can zoom from your smartphone. Different smartphone have giving different optical zoom feature like 1x, 2x or 5x, as you can see that smartphones manuals. Now, do not use smartphone flash. First, it is momentary flash. Second, it's very harsh light. It's not a soft light. It's going to affect the image quality of image. Then do not use finger to retract it and avoid bending. It's going to affect the photograph. Now, question arises, how to click intraoral photograph. Just to mention, till now, what all photographs you have seen, all are taken from a smartphone. None of the photograph taken from a DSLR. And I had taken all this photograph from Oppo F3 from the basic, my first smartphone. For intraoral photograph, use supine position. There is no strict recommended protocol. Some dental practitioners are comfortable with sitting position, and some recommend that supine position. It's up to you. Okay, the two position is recommended at the supine or sitting at 12 o'clock or 4 o'clock. It's up to you. Okay, I prefer that you use for intraoral photograph supine position, so you can able to capture good photograph with proper angulation. Now, the dental accessories is for intraoral photography recommended is contraster, retractor, and mirror. When you're using retractor, use big retractor so you can able to retract lip, cheek, and vestibular region. So because in intraoral photograph, lip part should not be seen. Lip or beard part should not be visible. Next, contraster. Contraster should be placed parallel to the occlusal surface. Avoid bending of the contraster to get Photoshop free background. Now, when you're taking intraoral photograph, place a mirror in a way that molar should not be touching the intraoral mirror. Please remember this. If you're advancing the mirror intraorally, so mirror should not touch the molar posterior region. There should be a gap between the molar and the mirror. And the angulation between camera and the mirror should be 45 degrees. Then you focus on premolar and then click the photograph. Do not focus on central incisor. Otherwise, what will happen? Remember rule of 1/3 and 2/3. The molar region will be out of focus. So please remember this. Angulation should be 45 degrees. There should be a gap between the molar and the mirror, and focus on bicuspid region. Same goes for mandibular. Same. The angulation should be 45 degrees. For lateral view, advance the mirror and don't angulate it. Again, there should be a gap between the molar and the mirror. And second thing, from opposite side, you should take the photograph and focus on bicuspid. Now, coming to extraoral photography, in extraoral photography, it is recommended that positioning should be 1.5 meter away and camera should be parallel to the face. And you can use what I'm using as a LED panel for your light, continuous light source. There are some standardization for dental photography like American Academy of Cosmetic Dentistry and European Society of Cosmetic Dentistry and Chinese Society of Aesthetic Dentistry. There are some standardization that for clicking intra and extraoral photograph. For example, when it's come for American Academy of Cosmetic Dentistry, it recommend you should take photograph in landscape mode, not in a portrait mode. AACD recommend landscape mode, not portrait mode. In photograph, from head to chin, region should be in focus. Second, when you take frontal non-retracted view photograph, the central incisor should be at the center of the image. That is the second guideline from AACD. Third, when you take the right and left lateral view non-retracted, the lateral incisor should be at center of the image. Okay, when you take frontal retractive view, the upper and lower arch should be slightly retracted. Same goes for right and left lateral retractive. I hope you can able to see the image now. Next image recommended maxillary anterior view with contraster. From in this image, canine to canine image should be in focus, and the center part of the image should be central incisor. When it's come for lateral view retracted with contrasters, lateral incisor should be in the center. Then comes to occlusal view of upper and lower arch. That's what we discussed earlier. Now, European Society of Cosmetic Dentistry recommend you should take portrait photograph in a portrait mode. The difference between AACD and ESCD is European Society recommend if patient with black hair, the background should be white. If blonde hair, then background should be black. Only that. And the second, the portrait photography should be in portrait mode. Rest all things is similar. Like in frontal smile image of the lip, center should be central incisor. In a lateral smile image of lip, lateral incisor should be at the center. And same goes for other images. Now, for half illuminated photograph, the operator position should be 1.5 meter away and light source should be placed at one region, not from both sides, only from one. So this will give dramatic effect for portrait photographs. Now, when you click artistic photograph, the light source, the continuous light source should be placed behind the patient. So what will happen now? The image will appear darker. To overcome this problem, use HDR mode. With HDR mode, the light can be adjusted and good quality artistic image can be taken. Now, one more thing, when you're using light source from back of the patient, use diffuser also. Just how to use, just put a white piece of paper, white paper behind the patient, tell the assistant to hold it, and that will act as a diffuser. Now, birefringence or cross polarizing photograph. How to take this photograph? Slice the tooth till 1 millimeter, less than 1 millimeter. Dip into oil, place between two CPL lens. This cross polarizing filter, a cross polarizing lens, place between these two. Put continuous light below it and click a photograph. So this type of image you can get with the birefringence image or CPL image, sorry. Now, there are some common errors in dental photography, like first, we come overexposed. The first error is overexposed. The second either is we remove or we decrease the intensity of light, so underexposed, or can't, the image is tilted, or the angulation is too superior or inferior, or the area is lack focus, means we are not following the rules, so anterior is in focus, posterior is out of focus, or the teeth is not separated properly, or you're not using contraster. If you're using contraster, the angulation is not proper, or you're using intraoral mirror for photograph, but it's say foggy or it's not placed properly. Your magnification is very excessive, means upper and the chin region is cropped. Okay, or if otherwise, or you're taking from too far, or backdrop you're not using. These are some common errors for dental photography. or you're using improper framing or inadequate retraction, like lip or beards is visible in photograph or retraction is not proper. So these are some common errors what we always come in dental photography. To avoid this, we should follow the standard guidelines. There are some recommended software I use like Adobe Lightroom, Snapseed, and PixArt. These are the free software available in Play stores. You can use this for skin smoothing and the eyes and lip or jewelry sharpening you can use, and you can get good photographs. So just in conclusion, I would like to say we all can take good photograph with your smartphone. For that, you have to keep clicking. Just keep clicking and don't hesitate or don't feel ashamed that with my smartphone I cannot click good photograph. So I hope from now onwards you can start clicking good photograph with your smartphones. Thank you.
Thank you, Doctor, for an excellent session. It was a
Thank you,
crisp
sir.
as well as very informative session. So I
Sir,
would like the participants to ask any questions
any questions?
so that Doctor will clear your doubts. Any questions, please? You can put it in the chat box. Doctor, before anyone could ask, I have a question. Like in
Yes, sir.
DSLR, usually we have this magnification ratio which we can adjust.
Yes, sir.
So
Yes, sir.
in mobile photography, how are we going to fix that ratio? Because it
Sir,
depends on how we move our phone, right?
Sir, in mobile photography, it is not recommended because smartphone photography is built for macro photography only. Smartphone lens, sorry, smartphone is built for macro photography. So this magnification ratio, it is recommended when we are using DSLR,
Okay.
but for smartphone, it's not needed, sir.
Okay.
Yes, sir. Sir, I am what lens flashlight I'm using this flashlight as I mentioned in lecture. This flashlight contact number I have put in a chat section. So whoever interested, they can directly contact to them to access these flashlights for intraoral. Just to demonstrate, if everyone can see, this is how it's look. Sorry, it's like how it is, and we can move it. This flashlight for intraoral. I will say in a group I will put this picture and how to access it. Which light?
I have a question here.
Yes, while taking the picture, which light is preferred? Dental chair, yellow light, white light. I discussed already this that we recommended is white light, daylight setting. That is 5,500 Kelvin. So our dental chair is not daylight. So we have to use flashlight. Like what I'm using, a unique flashlight, or you can get any LED light that temperature is 5,500 Kelvin. That flashlight is recommended for taking pictures. If anyone have any doubts, I have given my contact number and email ID also. Anytime they can ask any doubt regarding photography.
So doctors, please do ask. It's a very important.
Should we use HDR mode and click if you are using no, don't use HDR mode. HDR mode only is recommended for creative photography and only when the flashlight or the LED light is from back of the patient. What it is HDR modes are actually in suppose you are clicking a daylight photograph, so you will get sometimes shadow or some areas underexposed and some areas overexposed. So in HDR mode, this smartphone will automatically understand this light setting and it will put an image that is well balanced. Not neither it will overexpose or not underexposed. So this is recommended only when the flashlight or LED light is from behind back of the patient and you're getting shadow in images. Or else for normal dental intraoral photography, HDR mode is not recommended. When 12 megapixel when enlarged for seminar purpose. No, if iPhone 6 or 8, I don't remember exactly, that smartphone have only 12 megapixel camera. So it doesn't matter. Megapixel not is important. Important is sensor size. If the smartphone have good sensor or bigger sensor, that 12 megapixel is also sufficient. And currently what smartphone we are using, they all have standard smartphone. They have good sensor and 12 megapixel is sufficient. There's no such criteria that how much photo editing is allowed Just remember, zoom, focus, and short. First, we should know the framing, that what we want to focus. Suppose you are taking from too far, and the more area you are trying to cover, that is not important. Suppose we are taking intraoral photograph, for example. So I mentioned use the retractor, retract properly, focus on canine, and click the photograph. So first, we should know what we want to click. Either it's dental photography or any photography. First, we should know framing, the area, what we want to focus, and then click the photograph. So after that, when you crop and edit, the image quality won't compromise. And this software does not compromise the image. Image quality will be same. How to store pictures and retrieve it timely basis. This is a bit tedious. What we can do in File Explorer, manually we have to save this from like, I hope ma'am is asking about patient photography. So for that, you have to make a different folder, and after clicking that photograph, manually you have to save it. Till now, there's no app or software for that. Manually, we have to save.
What in this case, what I do is I create a folder for each patient on my
Yes,
phone.
sir.
I
Yes,
just
sir.
put it on that folder. It's
Manually.
easy to retrieve.
Yes, sir. Yes, sir. That's what, manually. With DSLR, that we have to take a first card, then copy in this laptop, then we have to do. That's the tedious. Smartphone, that we don't have to do.
Yes, yes, yes.
How we can make endo photography more clear with regard the use of flash. Satyan by flash is very important here first, and for endo photography you have to use a mirror. Either is front surface coated mirror. That is, I forgot to mention. In mirror, always invest in front surface coated mirror. That is zirconia coated mirror. Do not use back surface. Back surface mirror is very economical. That is 500 or 600 rupees or less than 1,000 rupees. But front coated surface mirror comes around 5 to 8,000 rupees. But that is one time investment. So please invest in front surface mirror so you'll get good crystal photographs. Zoom lens. No, I personally do not recommend any zoom lens. In dental photography, zoom lens is not recommended. If you're a smartphone user, don't need of any lens. And if you're a DSLR user, please use 85mm or 105mm macro lens. Don't go for 40mm macro lens. Either is your Canon, Sony, or Nikon user, doesn't matter. Use macro lens with 1:1 magnification.
Sir, I have another question. Now,
Yes, sir.
we use a continuous light for mobile
Yes,
data.
sir. Yes, sir.
So, do we need to switch off our flash, mobile flash?
Yes, sir. That is what I said. What three things we have to avoid: finger retract, angulation, and mobile flash. Mobile flash is very harsh, sir. There's no diffuser. So some area will be overexposed, other area will be underexposed. So do not use mobile flash,
So that
and do
will
not
affect
use.
affect the
Yes, sir.
quality of the image.
Yes, sir. And many like from different department, I got this query. Like suppose from oral medicine or from pathology, like how to click intraoral photography of lesion. For that, on a dent card, there's a intraoral light is available now from wall dent. So you can place into the patient mouth and switch on it. So that area what you want to focus will get illuminated. Then click the photograph. Now, one more doubt a student might have, that in shade matching, how to click correct photograph. So what I mentioned, that 5,500 Kelvin white balance you have to adjust manually. What I recommend, go to Pro mode, and the picture what you are seeing through naked eye, try to adjust in camera in that way. For example, if you are seeing that the teeth is yellowish, so do not just focus on 5,500 Kelvin. Adjust that white balance slightly. So same image when you're able to capture, so you will the shade mismatching chances will be less. What you're seeing through naked eye, same should be seen in the mobile phone, in a simple word. These are some standardization, but always you cannot imply that.
Yes.
So first thing, that always capture on Pro mode. That first thing. For iPhone, the software we have to download. On Android, this everything is available. And there's an option of histogram I shown in slide. So please look on histogram. It's overexposed or underexposed. Why it is important, sir? We click the photograph, it appears very good. But when you transfer into laptop or you're given to some other WhatsApp bit, the quality will be some entirely different. So that's why histogram is important for us. For gingival stippling, just dry the gingiva and zoom, focus, and short, what I told. Or else you can invest here macro lens. It's mobile macro lens comes around 800 or less than 1,000 rupees only. You can invest in that, and it's available on Amazon, mobile macro lens. So with that, just you will get a proper stippling image of gingiva. Can we set our setting in Pro expert mode? No, you cannot do that. every time we have to adjust it, pro mode. That's why it is pro mode, that every time we have to adjust it manually. Automatic mode means you have given all power to your smartphone camera or DSLR camera. In pro mode, you can control everything.
So do share the apps that you have recommended for iPhone. Do share it on the WhatsApp group so that we can
Yes, sir.
download.
Yes, sir. Sure, sir. I will share all tips and tricks on WhatsApp group now, sir. And the links of this lens and flashlight from where we can access. You can access it, sir.
Okay.
Doesn't matter. Even this continuous light can be used with DSLR. It's not like this continuous light is only for mobile phone. If you are a DSLR user, this flashlight also you can invest it because it's economical one. Why to invest in a speed light or strobe? That is very costly, and dental photography it's very hectic. With a small LED light that's come 2,000 rupees, just hold with your hand and focus, and then you can click.
I have the speed lights in my clinic, so
speed light is damn good, sir, but the problem is the momentary flash. Now, that momentary flash, sometimes first we have to TTL, we have to adjust manually and then click the photograph. That is a very tedious job, sir. With in continuous light, like I am having this, just switch on it and adjust it manually, and I can hold free handly like this.
Okay.
Thank you so much.
So
any more doubt, you can ask in WhatsApp group also. I will try to answer it, and I will share the other tips and tricks in WhatsApp group also. And if you have any other doubt, you can message me personally or on Insta and Facebook or email also. You can email me. Okay. Okay, sir.
This is really a very fantastic session, Dr. Khatib, and thank you, Dr. I think, do you want to add something, Dr. Rameez? I think because you are also into mobile lens photography, right?
I am more into DSLR, sir. That's what I had so many doubts on mobile.
I think we have another session with DSLR photography.
Yeah. But I would definitely, like, as Khatib sir told, the thing is, see, we all have phones all the time in our hands. So it is a fantastic equipment that, available all the time. It's not like DSLR. DSLR requires a lot of equipments. Like you need macro lens, you need a good ring flash or twin flash. Now I have speed lights also in my clinic. So the clinic gets congested as well as to take a photograph. The patient should turn into a model, actually.
I think very rightly put by Dr. Khatib. I think not everyone who's owning a photographer.
So we all are photographers, we all are dentists, we all are good artists, and we all are photographers. The only thing we should believe in ourselves, that we can click photograph with our smartphone.
I think it also requires a little bit of training, as to how to use your camera.
Sir. Yes, sir.
What setting means what. Like actually they say this, the thing about shutter speed and then the white balance, temperature control, and then the other noise and stuff like that. Not many people even knows about it, right?
Yes, sir.
So when you're talking about photography, I think it's very important to know the basic things of what means what, as in very right by you.
Yes, sir.
In terms of the white balance, meaning
that's why, sir, I try to focus on where to click, sir, actually, more.
Exactly. It's just not about the focus, but also, it's just not about, but also about the settings, which is very important to clear a very clear and appropriately.
Yes, sir. Correct, sir.
Sir, in case of, as you told about the settings, sir, in dental photography, when it comes to DSLR, it's a fixed setting that we use. It's so it's easy actually. Once only thing is you, as you know, I think in the first slide you have put it that we need to keep clicking photos. That's it.
Keep clicking.
The more we click, the more our hand will get.
Yes. Only problem with DSLR, I feel that it's a costly first thing. Everyone cannot afford it. Like accessory equipment, because macro lens is a bit costly, like 80,000 rupees, I think. So starting price.
No, I think the lenses are more costly than the cameras, Khatib.
Yes, sir. That's
DSLR, sir, I think the cameras are cheaper than the lenses.
Sir, like smartphone, if you budget 50,000, we can get lens, light, and but in a smartphone, we should have budget at least for 1 lakh rupees, at least.
Yeah.
If you want to go upper and DSLR full frame, that is very costly, sir. Full frame then.
I think when it comes to DSLR, I think for the near objects, there's a different lens. For the farer object, there's a different
Yes,
lens.
sir. There's different prime
You
lens,
have
macro lens.
on this, I would like to add, sir, you have a kit lens that is usually 18 mm, which is actually a good lens for dental photography also. You
Yes,
just
sir.
need to have some, like how we use mobile phones, a basic lens also will do. But
Same.
as sir told in a seminar, the most important aspect of photography is light. So you need
Light.
to have a good light, not the camera and lens comes second, the light comes first. So we need to
Whoever are using DSLR, I personally recommend that if you are having DSLR, please invest in this LED light available on Amazon. That is very, very economical as compared to bigger flashlights. And it's a continuous light and it will come set of 2 to 4,000 rupees only. It's worth investing as compared to DSLR light.
What is the cost, Dr. Khatib? What is the cost of the mobile, the side lenses, I mean, side lighting you had?
Sir, this kit, what I'm using, this kit, I have given the contact number. This kit costing around 10,000 rupees. But if you're using this light only, separately purchasing, so that's cost 2,000 rupees on Amazon, sir. LED flashlight.
Okay, we have a small request in the chat.
I will share this link, everything on WhatsApp group, sir. I will share these links.
Thank you so much. We have a small request in the chat. One of the doctors, I think Dr. Arsha, she wants you to, both of you, to share dental photography from both. Yours is mobile and from Rameez, I think DSLR.
Yes, sure.
If any of the other participants have any questions, I think the floor is open for you people. You can just unmute yourself and then ask questions to the speaker and the moderator.
Yes, sir. Last week, sir, I had this lecture on GDC Raipur about mobile dental photography. So in that,
I saw the flyer. Yeah, I saw the flyer.
Participants were more interested in hands-on as compared to lecture. Lecture was a short while, so then because once we start hands-on, so they were able to understand that how to do the camera setting.
Inshallah, we will try to organize a hands-on workshop as well. Inshallah, in the coming future. Yeah.
As we kept on talking about the expensive part, what I feel is once you start with the dental photography, that itself will bring in a lot of patients. Like the more we showcase our, the work, that actually increases the, the income also. So I won't tell that it's a waste of money. It's even if you put in the money, definitely we are gonna reap the benefits of it. So I would definitely suggest.
Someone can afford Maruti, someone can afford Mercedes. It's about what we can afford. So what we can say, we all able to reach same destination, either it's Maruti or Mercedes, doesn't matter. We can able to. So either a smartphone or DSLR, we can click photograph, and 99.9% we are going to upload on social media.
Yes.
So with a smartphone, we can click. When it's come for flyers or good photographs for like banner, then DSLR plays a significant role, sir. Definitely, sir. Then image quality should be enhanced. But like for social media, if you want to showcase our work, so smartphone also play good. Means just once you start, then slowly once clinic start running, invest in DSLR also. And the best part DSLR, sir, once you have DSLR, I own a DSLR actually. In my post-graduation time, we purchased the DSLR, then I took it. So definitely with DSLR, we can click other photo like landscape photography or macro photography or other aspects also we can start.
Both mobile photography as well as DSLR photography, both have their pros and cons to their own, In fact, I think the situation and circumstance as to what you want to handle and then what best you can do. I mean, I personally know of people who can do wonders with just mobile, and then there are people who do wonders with DSLR.
True.
I think to each their own. Both are good in their own sense, and then it's not like this is better than this is better.
True.
Use it, and then if you know the settings, like I said, very beautifully explained by you in your session. If you know the settings, I think you can do it wonders.
True, sir. If you have good big setup, a sufficient space, and you can invest in DSLR. If you cannot, then start from a smartphone.
So I think from tomorrow,
actually, photography and stuff like that. If the photography is their passion, I think money is not the
Sir,
constraint.
photography is fun also, actually, sir. I say.
Yeah,
I
offline
started
it's
as a
catching
fun,
up
sir.
now. Yeah.
Photography was not a passion for me, but I say that it's once we start clicking, we enjoy it, na, sir. Like I will say, like doing endo. If you are unable to locate canal, it's very frustrating. But once
But
you
actually,
find the canal, endo is fun.
no, truth being told, Khatib, the thing is, the
Sir,
moment you do post graduation now, there's so much of peer pressure from the your
sir.
peers and the other supervisors that you have to invest in a DSLR. You have to. I really don't understand. This more so than personal interest. It is more so towards the peer pressure. That
True,
for photography.
true.
Then you begin to like it. That's a different story altogether. Yeah, but then.
And one more thing, sir, like if you start photographing your work, it will definitely improve your work also. You can see all the
Yeah.
mistakes that you have done, all the,
Uh-huh.
especially I do a lot of composites, so I can see those margins now.
Yeah,
I could
we can
improve
zoom
on
it.
that because of the photography. So I would
True, sir.
definitely
More than the
recommend people.
treatment planning aspect, more than the treatment planning aspect, the reason for photographing your cases and your patients is for documentation.
Yes.
True, sir.
This is very
True,
important.
sir. True, sir. So,
Any questions?
So I think people are all happy.
They're all happy. I think
we are expecting that more
it's
dental,
almost 10
sir,
o'clock.
more dental photography update on our group, WhatsApp group also, that people start sharing not only cases, any photographs, either it's sectional teeth photograph or creative photography.
I think if there are no more questions, I think
Okay,
Rameez,
sir.
call it a day.
Yes, sir. So thank you, Dr. Khatib, for a very informative session, and
Thank you.
as well as to make it look so easy. Also, hopefully, we all start with the first case from tomorrow. We start documenting.
Inshallah.
As you told, we start clicking with our like phones, and hopefully we keep improving every day. Thank you so much
Inshallah.
for your time, sir.
Thank you, sir. Thank you so much, sir.
Thank you, everyone. Thank you, sir.
Yes, sir.
Thank you so much for both of you.
Yeah, thank you.
Thank you so much,
Efforts
sir.
and then time. Thank you.
Thank you, sir.